Okay, hey everybody.
Hey everybody.
Cody Barnett and Dr. Doug from Bodyworks Physical Therapy and Concussion Center, and we are officially live for our hip pain and IT band webinar, and we're excited to have all of you joining us, and we appreciate you being on here with us, so thank you for coming. You want to talk a little bit about what we're going to cover, what we're going to be going through tonight, and kind of what's going on?
Yeah, we got something first though.
Okay.
Okay, we're sitting
What's
here.
that?
We're sitting here before we went live. We're thinking we need a theme song. Okay, so all you guys that are on, think of a theme song, like something like redneck, banjo, the Rocky theme, Green Acres. I don't know. Type in some suggestions. We kind of need some help.
What's the theme song for Dumb and Dumber?
I have no idea. We're better than that, though. We're better than that. So, anyway, tonight's agenda, we're going to have fun, and we're going to answer a lot of questions regarding hips, IT bands, hip problems, hips, pain with sitting, people that have been suffering a long time, people that are afraid of what's going on and afraid to ask. We're going to cover just a whole lot of things. But what we'd like for you guys to do is actually, so we can tailor this talk to more to where you guys are at, is type in your place, one, where you're from, say hello, but then type in questions, specific questions, because we love to have questions and help you to understand what's going on and why it's going on, and then what you can possibly do about it. So type in, say hello. Can you hear it? Can everybody hear us? Wave, do a thumbs up, something like that. And let us know where you guys are at, and type in your questions. So,
and we will tap into those as we go through. So we want to make sure we get all your questions answered.
Yeah. So it's right at 6. We may kind of waste a little bit of time here, wait for everybody to get on. People are kind of coming on in stages. So anyway, we're gonna have a good time. This is what we do. We've been doing this for 29 years. And so we see this stuff every day. I saw a hip patient today. She comes in and she had hip issues, and we figured some things out, got her going, and she's moving better. We've had, everything from soup to nuts, from osteoarthritis to torn labrums to torn muscles to lax joints to weakness, tightness. Why is my rear end hurt? I can't stretch it out. We're going to answer a bunch of those questions tonight. So. Good.
Okay, and one thing for everybody that's watching, we are going to be doing kind of a really cool big giveaway.
Yeah.
We're going to be giving away one of these tonight. This is called the Viper foam roller. We call it the foam roller on steroids. And here's the cool thing about it is I hope this shows up on the video, but this is a foam roller that vibrates. It's made in Germany, German engineered. We have a lot of professional athletes that use these. We have a lot of weekend warriors that use these. But this thing is fabulous.
Yeah.
And we're going to be giving one away. But you got to be on at the end of the show to find out how to win. So we're excited to be able to do that. And these retail for about $189, $199 bucks. Mm-hmm. So we're excited to be able to give one away, and people just love them. I've never had anybody come back and say, I don't use it or I don't like it.
Yeah, everyone loves it, especially like your professional roller, people that roll like half hour, 45 minutes to an hour. They said they can get twice as much done in half the time. And it's just from post-op patients to serious runners, triathlon, trigger points, people that sit all the time, get tight muscles. It just does wonders. So we're going to bless you guys and give one away. So, yay.
Okay, well, should we get rolling?
Let's roll.
Should we start? Okay. We got any questions or things like that so far?
Well, we've got a hi from Marin and Lewis and Jennifer.
All right. Hey, everybody.
Hey, guys.
Thanks for jumping on with us. Okay, so what we thought we'd start with is something that we literally hear every day from someone. Like, there's not a day that goes by that we don't hear this. And this is pain either in the hip area, rear end. Actually, you do a better job at this than I do. Maybe
okay, it's when people sit.
Start with this one.
Right, it's when people sit. Okay, they sit and they sit at their desk or they're in a car, stuff like that, and they do this. They get up and they go, and it takes them about 10, 15, 20 steps, and then things kind of shake out, and then they're fine. Has anybody ever done that? Yes. We see that literally all the time, and can be several issues. One of them, here I'm going to get my trusty model out here. Okay. There's our model. Okay. This is you. Okay. This is you. Here's your pelvis. Here's your legs. This is you sitting. Now you see this muscle right here. This is just one thing that can be going on. This muscle right here attaches to your low back and attaches to your thigh bone. It's called your iliopsoas, but in my term, it's your filet mignon. Okay, so I tell people, you got a tight filet mignon. So throw that in the conversation sometime and just kind of see what the reaction of people. Say, yeah, my filet mignon's a little tight today. Just kind of watch the reaction. It's kind of funny. But anyway, what happens if you sit, your body adapts to that short position. Okay, so this is in a short position with your legs sitting. Then you have to go to stand up. That muscle has to lengthen. Okay, but if it's been sitting for a half hour, an hour, 2 hours, whatever, it doesn't stretch out really quick. So that's why you have to go, yeah, and then kind of work it out to loosen it up. Okay, very common, and we see that a lot, and that has kind of a secondary issue, because when this muscle gets tight, it shuts your rear end muscle off. Okay, and so one of my patients, Lynn, basically, and I've done a couple videos on this, when this muscle gets tight, this one gets weak. Okay, we call that sitter's butt. Okay, sitter's butt is when you sit too long, this gets tight and this gets weak, and it kind of throws the mechanics off, and then it gives you hip problems, things in the back, pain down your leg, stuff like that. So for all you out there that sit a lot, you might have what we call sitter's butt. Okay, there's lots of things we can do for that. Get this thing stretched out. There's usually trigger points in here. There's weaknesses. We got a special manual muscle tester we use that's electronic. We can get down to 1/10 of a pound to measure exact strength to see what your strength ratios are. And if they're off, we know exactly where to work. And then within just probably a few visits, people are trucking right along, getting better, because then they understand what's going on and why. And they're not just sitting as long. They're teaching them to move, because our bodies were meant to move, and they come out of their issue. So anyway, sitter's butt for the first one. That's
very common.
That's the first one.
Very common. So then kind of a bit of an opposite after that is somebody who exercises. Maybe they walk or run, something that's more active. They just went to the gym and worked out, whatever, elliptical, whatever it was that they did, and do really good with that activity. But then it's like 30 minutes or an hour later, then they're going, oh man, what the heck did I do? Because it didn't bother them with the activity,
right,
but then it bothers them after. And so that's another really common thing that we see, and that can be more of a rebound effect from the activity as you're active and mobile and moving and doing whatever exercise it is. Then what do we usually do? Let's say we've been at the gym, we worked out, we felt great, we're like endorphins are going, I feel really good, and then where do we go? We go to the car and we drive home. Or we go home and go, man, I worked out really hard. I think I'm just going to sit here and watch a little television or whatever. And so then you're now taking these muscles that have been in a very active, lengthened position with lots of blood flow to them. And now we're going to put them in one position for a long time and just kind of hang out there or sit there for a while. And then you go to get up and then it's like, oh, dang, what did I do, right? And so that's really common. And that can be an issue, of either a flexibility issue or a strength issue in the hip, either the side or the back of the hip, where those muscles need a little bit more mobility after exercise. Right. We need to be doing something after exercise as recovery to help that pain.
What muscles usually do you see when you see that? That are the issues?
Gluteus medius muscle on the side, rear end muscle, either glute max or piriformis through the rump.
Yep.
Sometimes hamstrings on the back of the leg.
Yep.
Be real common with that.
Yep. Yep.
And so doing some activity after post exercise, or knowing what activity to do post exercise is really helpful. On that front, one of the things that a lot of our patients find really helpful and use a lot is a couple of massage tools. One is this one right here. It's called a tiger ball. And basically, this is it looks really firm, but it's actually got some nice squish to it. And what you can do is stand up against a wall. You put that back there on the rear, and then just kind of lean against the wall a little bit with that behind you. And kind of like a bear scratching his back on a tree, you go up and down, massage that out. And then the other thing is something called a tiger tail, which looks like that. And you use that on your, for example, if we're talking hamstrings, put that on the back side and do a little self-massage on there. And I don't know about you, but I use one or the other of these at least on myself, at least every day or every other day of my life.
I don't need. I'm just in that good a shape. I'm not that old yet.
Right.
I'm still 19 right here. So I use a tennis ball. I give my patients a tennis ball. I get free. I'm going to give a shout out to Rex at the country club. Okay, thanks Rex. He gives me 55-gallon bags full of tennis balls that I give away to my patients, and they're helping people all over the place. So thank you, Rex at the country club. Was I supposed to say that? I don't know.
No, that's great.
Rex is a great guy. Appreciate you. Okay, groin pain. Some people get up and they have this deep groin pain. Okay, that's part of the hip. They don't know what it is. The most common thing we see with that is probably an arthritic hip. Would you say? The hip joint here is right here in front, and it refers pain kind of in this area. And when you have bone on bone in there, you have a pain referral pattern, and a lot of it is in the groin area. Okay, and so when people come in with groin pain, one of the first things you think of, okay, let's take a look at that hip, and we do some different examinations and special tests. And one of them is called a scour test, where we'll lay the patient down, and we'll bring the leg up, and then we'll push the leg into the socket. This is the socket. This is the thigh, and we'll rotate it. We'll compress and rotate. And if you have a cartilage deficiency, or if you have arthritis in there, their eyes light up. It hurts, and it causes that groin pain. Okay, and especially with sitting too long, walking, you'll see a limp. A certain type of limp. It's called Trendelenburg gait, where they're trying to offload that hip a little bit. That's also common with an arthritic hip. But one of the things I found, I was just reading a research article that manual therapy and strengthening exercises are great for hip arthritis. So you're not doomed to have a total hip. There's things that you can do to actually come out of it to help with the health of the hip and help with the health of the muscles around it, so you don't just wear that joint down. And one of the other things is we found is your range of motion. And so when we'll lay people down on their back, we'll take their leg, and we should be able to rotate it this way. Okay, see how far that one goes that way? You should be able to rotate your leg at least 30 to 45 degrees this way. Here's what we see a lot. We see patients go this way really well, like they're crossing their legs, but then they get here and they go like this, boom. Okay, that's indicative of a tight hip. Okay. And so we work on things to get that motion, because you need that component motion in your hip to be able to walk. Okay, you'll do the sitting thing. You'll get up and you go, oh, you can't hardly walk and you limp. But one of the reasons is that hip is tight, so you got to get it going this way, and you also got to get it going that way to open this stuff up. So if you have all these muscles around the hip, they're so tight it jams that joint too much.
And even if somebody has some arthritis in there, which a lot of us do, if you get the motion going, you get the strength better. We've had dozens and dozens of patients that actually are able to put off like any sort of surgery, hip replacement, just by simply getting normal motion restored to the hip joint, and getting their strength better. And then, so just because somebody has some arthritis in their hip joint, doesn't necessarily mean you're relegated to now go get the darn thing replaced.
No. In certain cases, yes, but honestly, a lot of times you can help a hip. A lot of times you can help it. So that's kind of what we specialize in. We specialize in taking time to sit down and listen. What's going on? How long it's been going on? What bothers it? What makes it better? And then do a really thorough physical exam with lots of special tests. I mean, my special test for my hip is like 2 columns long on my evaluation page. And then we sit down and explain to you what the heck is going on, what we're finding. So then you know oh, okay, well that makes sense. Well, then they go, well, what do you need to do about it? And then we can get on a plan to get them better. But a lot of times there's a lot of fear. You know, people are just afraid of what's going on, and they're afraid to ask. And so if I can encourage anybody, just take one step, have somebody just take a look at it, and we'll just tell you what's going on. And if we can help you, we will. We'll tell you if we can, and it's needs some other help. I mean, we're all for helping people get to the right people to help them get better and overcome their issue. So, okay, Melissa, you have a question for us?
We do. Lewis says, when I lie on my side at night, I wake up with an ache in my hip that was on top. What can I do to help alleviate this?
Question, Lewis, when you sleep on your side, do you put a pillow between your knees? We'll have to give him time to respond. One of the things that can happen, yeah, that's great, is when we lay on our side.
I'll be Vanna.
If we're can I have an S? So as we're laying on our side, and so this is our skeleton laying on our side, bottom leg's here, top leg's here, and as our leg kind of droops down and in, there's structures and muscles that run across the top of this, and now we're putting them basically on a slight tension or load, kind of like a fulcrum or a pulley over the top of that hip bone right there. And normally to be in that position, no big deal, doesn't bother us. But if you're there for an hour or 2 hours with that constant tension placed over the top of that, that can be enough to, over time, just cause that to be achy. Usually you get up, you walk and move, go to the restroom or whatever, and it'll get better.
Right.
But typically the simplest, most common thing, assuming that your pain is over the outside of the hip, not somewhere else, typically the most common thing to help that is simply throw a pillow between your knees. And then that gets your legs symmetrical or parallel to each other.
Right.
And it will decrease that load over the top of the pulley.
Right. Unless they got something going on in the joint here, if they got like a cam or pinch release or something in the joint to see, because sometimes that joint can't quite close down too much because there's a little bone here, and this is a little bit off. That can compress there and give you some groin pain. But we can figure that out, whether it's this or whether it's that. But pillow between your knees is your first line of defense.
He mentions he does sometimes use a pillow.
Okay. Good.
So you might even experiment a little bit, Lewis, with the thickness of the
pillows.
pillow.
Yeah. Double it up.
Imagine in your mind's eye what we just had up there, and think about you're trying to keep this in a relatively neutral position and not let it sag down. So that would dictate the thickness of the pillow that you'd use.
Yeah. Good. Thank you.
Good question. Yeah. So how about popping in either the front of the hip, or popping in the side of the hip?
Okay. You can have several different things going on. If you have popping in the front of the hip, and sometimes people have what's called a C sign. Okay, they'll take their hand and they'll go like it feels like it's just like deep in there. Okay. If I could just take my hand, just grab it way deep in, that's called a C sign. That's actually a special test, and that's indicative of a joint pathology. And so sometimes if people have snapping, you have a couple different things possibly going on around the hip socket here. Whoops, don't need that one. Around the socket there was what's called a labrum, a piece of cartilage. Okay, and sometimes that cartilage you can get a catch in that, and then when you move. That if it's torn in there a little bit, it'll snap in there. If you rotate on it just wrong, or you sit, and if the cartilage tears in the front, that can give you some problems. We also have what's called a snapping hip syndrome, where your iliopsoas muscle snaps right around in here. That can be from tightness in the hip. Anything else you see with?
And then laterally, IT band.
IT band, yeah, your iliotibial band, your IT band, and I just put on a video Friday or Saturday, one of the two, about IT band, and it's a muscle that starts up here, muscle here that turns into a band and comes down the outside of your leg and to the outside of your knee, and sometimes that can snap right over your trochanter, right over this thing here, and if that thing's really tight, you know how it gets tight? Sitting. When you sit, it shortens that muscle up and it shortens the tendon up on the bottom end, and then when you have to move, it snaps. Okay, so We need to work on that, get that moving and going, get the hip joint moving. A lot of times that'll alleviate that lateral snapping hip issue. So
Very common.
Okay.
And sometimes there's some popping in hips that can be, you know, what we call pathological, or it's problematic. There's something wrong there. And then sometimes tendons move over the front of the hip joint. Sometimes it's popping, but it's not painful and it's not necessarily pathological. It's not necessarily harmful. So it's real simple for us to do a little testing and figure out, okay, is this a harmful snap that I need to be worried about?
Right.
Or is it like no big deal and just go on with my life and don't worry about it?
Right, and the other thing you want to think of is what's going on from the bottom up. How's your foot mechanics going? Because foot mechanics actually affect what happens at the knee and at the hip, okay? And hip mechanics affect what happens at the knee and the foot. So it's not just the hip. Sometimes the hip is a squeaky wheel, but you got to go look other places sometimes to find the root of the problem. Because I mean, if these are your symptoms, you can chase symptoms all day long, but until you get to the root of the problem, and that's what we do here. We look for the root. Get to the root of the problem, figure that out, fix that, all your symptoms go away. And that sometimes can be in the hip, or it can be low back, SI joint, foot, knee, a compensation in the knee from a torn meniscus, arthritic, tendinitis. It just changes your mechanics a little bit, but that becomes a squeaky wheel in your hip. So that's why we take a good history, look at the whole kinematic chain, and figure out where the root of the problem is coming from. So,
Very good.
any other good questions? Type your questions in if you have any.
Okay, well, Melissa's looking that up. I want to talk about front of the hip pain versus back of the hip pain and why it matters.
Okay.
Okay, so real common, this is a really common thing. Somebody comes in, they'll have pain in their rear end, right back here in their tush, okay? And they'll be really worried, they'll be really concerned, and they'll go, man, my rear end has been hurting for 6 months. I'm scared to death. I need to have a hip replacement.
Mm-hmm.
Okay, like this happens quite commonly. And so here's the interesting thing that you'll want to know that helps you differentiate a little bit. Typically, when we have things inside our hip joint in that ball and socket joint, if the problem's in the ball and socket joint area, that's going to be more right in the front of the hip.
Right.
Okay. Whereas if it's the rear end back in here, that's going to be more muscular, more either muscle problems or could be some irritation from your lower back or sacroiliac area. And so that's one of the first things that we key in on is, okay, is it front of the hip pain or back of the hip pain? If you're having pain in the rear end, you can go, I don't need a hip replacement because that,
Most likely.
99.9% of the time, people with something wrong in their hip joint is going to be more in the front
Right.
Instead of in the back.
Right.
So that's a common question that I get, and want to make sure, because you can kind of, in a way, kind of self-diagnose yourself a little bit just by
Right.
knowing that,
Right.
by knowing that fact.
Right. Another thing we see is pain on the outside of the hip, which is right here on that bone. Okay, we see it with people when they sleep at night, they lay on that hip, or there's pain here, or there's pain just right above that hip bone. There's a couple different things can be going on. There's a bursa in there. Bursa is like a fluid-filled sac to help with friction of things. Sometimes that bursa can get irritated. But the other thing that we figured out, there's something else underlying, because it's with gluteus medius muscle. And what happens is it looks like a trochanteric bursitis, so people will get shots in it and the pain goes away, but a month or two later the pain comes back. And they get another shot and the pain goes away, but then it comes back. And once you start going through the hip, there's a certain test called a hip external derotation test, and that's for a tear in one of the muscles right in here, okay, right in the side of the hip. And you have pain, like if you sit, if you take stairs, when you go up with that lead leg that's sore and you push up, that makes that muscle engage, that can be sore. If you try to bring your leg across and try to stretch it, that can be sore. And that can be indicative of a possible gluteus medius tear, which is like it's like a rotator cuff tear of the hip or the shoulder, but it's of the hip. And a lot of people don't look for that, but we have found quite a few, and we can differentially diagnose what they call this is a trochanteric bursitis or is this a glute medius involvement. And then we have them go get some imaging and find out, okay, is this ruled in? Is it positive or is it negative? If it's negative, great. If it's positive, okay, there's some things we can do to help with that. Mm-hmm. So that's another thing and you see that probably in 45 to 65-year-old people. It's not probably younger persons, it's more in that other age bracket. but it's for glute medius, and sometimes it'll keep them up at night. It'll just ache, it just hurts. And when they walk, they'll have a little bit of a limp on it, and going upstairs and sitting, that really hurts in that lateral hip. So that's another thing we see.
And then to the less severe thing is it can be a bursitis.
Can be bursitis, yes.
Over that spot, which is really common. And then the other part is the muscle may not be torn, but you can get what we call a tendinopathy in that muscle that attaches on the outside of our hip bone. So the reason God created this big old bump out here on the side of our hip bone is because there's a ton of muscles that attach on the outside of that.
Right.
And so it's big. So you got this big bump, this big bone for all of these big glute muscles that are really big and strong and meaty to attach onto that. And so sometimes people get what we call a tendinopathy. And tendinopathy is not a tendinitis. Tendinopathy is actually where the tendon tissue changes, the quality of the tendon changes. And that's something that responds very, very well to therapy, something that doesn't require surgery, something that doesn't, in fact, injections typically won't help it. It's also the person that maybe they stop the offending activity for a while, and they go a month, and then they start the offending activity again, and they're like, holy cow, this pain is still there. I thought it was gone.
Right.
And so that's a real common sign of what's called a tendinopathy, but responds really well to therapy techniques and a type of exercise called eccentric loading that's really helpful and very, very treatable.
Right, and we see all these hip type of issues in runners, pickleballers, tennis players, bicyclers, triathletes, office workers, weekend warriors. It's kind of spread throughout. So we see a kind of a wide range of different backgrounds that people can be suffering with this from, and there's no reason to suffer with this stuff because there's lots of things you can do for it. And I think, like I said before, sometimes you're just kind of nervous or afraid of finding out what it is, but there's literally a lot of things that you can do for hip issues.
I find a lot of people are either fearful of what they're going to find out, or they're fearful of not being able to be active and do the stuff they want to do. So, a person, they've got a big trip, a big vacation coming up.
Oh yeah.
And they're like, how am I'm taking
How am I going to walk?
Taking the kids to Disney World. How am I going to get around Disney World with this thing bugging me?
Get in here, let's figure it out, and let's get you going. Yeah, I got a gal taking a trip to Italy, and she's doing better. We got her some different things, and she's thinking she's now going to be going to Italy and be able to walk, 8 to 10 miles a day is what the trip people say, and she's excited about that. So there's lots of different strategies. I mean, we've been around this thing for how many decades? You figure out the little tricks and things that are common sense, but you just don't know them. I call it rocket scientists, these little things that are like so simple, but they're so profound.
You don't know what you don't know.
You don't know what you don't know, but we can help people because knowledge is power. And if you understand just a couple of the things, you can go, this is a workaround. We can get around this. Oh, this is great. So anyway.
Hey, let's, did you have something for us?
Dwayne says that he's got a similar problem when he lays in bed and the hip is hurting. He said he just got up one morning with pain in his groin. Says very active, never had anything like this before. Now when I lay on my side at night, I have pain and numbing in my hip. As long as I am up and active during the day, I do not have any pain. Okay. I do sleep with a pillow between my legs and have for a long time.
Okay, good question. So, if in case people didn't hear that, Dwayne he's having pain and some numbness in his hip, worse after getting up after sleeping. He does use a pillow between his knees, but does better when he's active. So, do you want to diagnose that, or you want me to?
Go ahead.
Okay. So I'm going to say if it's a hip joint problem, for example, something like an arthritis inside your hip joint or a labral tear inside your hip joint, that's usually going to bother you more with weight bearing. That's going to hurt more with walking, stairs, active things where you're on your feet. Whereas if it's more with inactivity, which sounds like it's bothering you when you're waking up, that might be more to a soft tissue problem. So soft tissue would encompass, is it a muscular problem in your hip that's either being put in a bad position and getting pinched while you're sleeping, or is it just the muscles getting shortened while you're sleeping? But we want to kind of look at from a soft tissue standpoint what stuff's going on and examine that and then figure out what's happening.
I would also look at if there's a pelvic obliquity, if your pelvis is kind of twisted, because I've had a lot of people get a twist in the pelvis. It's asymmetrical. You get asymmetrical forces running through the joints and in the tissues, and a lot of times if you can unload and correct that asymmetry, you're fine. And I've seen that quite a bit, because sometimes when you have different odd type of symptoms and positions, a lot of times an asymmetry in the pelvis, you correct that, and they get up and move, they roll over on the table and go, well, that doesn't hurt anymore. So, and then we show people how to keep that corrected so it doesn't kind of go out. And also, if you, at night, you also think of your mattress. How's your mattress? How old is your mattress?
Yeah.
I have a record. 43 years, I had one patient. I asked her how, she had a back problem. I said, how old is your mattress? She goes, oh, it's old. And I go, how old? She goes, well, I really don't want to say. I said, no, you got to say how old. She goes, she looks both ways. She goes, 43 years. I go, okay, you're going to mattress shopping this weekend. And here's why I say that. Is that when mattress gets old, what happens is it sags, and that's called hammocking. Okay, when you hammock, that rotates the pelvis. When you side bend like this, it rotates the pelvis. If you're laying there in one position or the other for 30 minutes, 60 minutes, whatever, your pelvis will kind of shift. I've had a lot of people say, I wake up and I can't move, my back is locked on me. And that's the cause of it. It's a torqued pelvis. So if I can ask the question, how's your mattress? Is it new, relatively new? Do you hammock much? Stuff like that, because that can be a root issue cause of what you're dealing with. So great question. Thank you.
Very good question, yeah. Let's see, we've touched on it a little bit, but we want to make sure that we talk about, or more thoroughly cover IT band stuff.
Okay.
So Dr. Doug was saying how the IT band starts up here on the side of our hip, and it actually starts out as a bit of a muscle, and then it becomes just connective tissue, kind of like your Achilles tendon type of material, but it's wide. It's about that wide, and it runs down the side of our leg. So when we talk about IT band, that can be a source of pain either up in the side of the hip, either over the bone. It can also be a source of pain in the side of your thigh, or it can be a source of pain even down in the outside of your knee. And that IT band is made of connective tissue, and because it's connective tissue, it doesn't stretch well, but we usually find that if we stretch the muscles that it attaches to, like your quad muscle and your hip flexors and your hamstrings and so forth, that helps. And then there's also some manual therapy techniques that can be real helpful in loosening that up as well.
Yep.
These people are going to be, a lot of, we see lots of runners and triathletes. So people that are having either pain with running, cycling, either knee or hip, that area can be a real common source of IT band pain.
Yep. And also we found trigger points in the lateral quad.
Exactly, yeah.
I mean, if that's been, we think it's the IT band. Work the IT band, they go, nah, it doesn't change much. But then we start looking at the lateral quad trigger points, and it's like, yeah. And then you work on those, and they go, oh my gosh, that's so much better.
Yep.
That's when the roller things come in to help give the tissue some work. So.
And then Brenda would like to
Another
know
question?
how to stretch out her IT band.
Great question. We're not set up to demonstrate it right here, but if you'll go back to our video on Friday.
I put a video out Friday or Saturday, okay? IT band issue, go to our Facebook page, and I just put a video out on IT band, what you can do about it.
Yeah, it was on, I think, Friday or Saturday.
Yeah.
And then if you're watching this as a replay, if you're not watching it live right now, actually if you go to our YouTube channel, which is, you can get to our YouTube channel from our main website. We've got that posted on there too.
Yeah, there's a great IT band stretch that one of my colleagues and I, back in PT school 29 years ago, figured out. We reverse engineered it because we heard, okay, cross your legs and go like this. Well,
it doesn't work.
That don't work. That don't do beans for anything, okay? You can't stretch a muscle when it's engaged anyway, so it's on that. So we reversed engineered it, and we figured out how to start stretching that. And it's really interesting how tight some people are. But go back and look at the Facebook page video from Saturday on IT band. I'll show you how to do that with deep explanation.
And then we
Okay.
have a new question.
Oh, okay. Go ahead.
Cindy says, I have a hard time putting my sock and shoe on my right foot. I also have a jarring pain when I step and turn too quickly. Sometimes after driving the car 15 minutes, I get short jabs of pain in the hip when I start walking.
Okay, that's one. That's one where we want to look at your hip joint.
That's a hip.
That's-
That's like a hip socket thing.
That's a ball and socket joint that we definitely want to get evaluated.
Yeah, and she also mentions that it goes away if she turns her foot inward when she walks.
Okay.
Yep.
So a little internal rotation.
Yeah, you're just changing the mechanics of what's going on the hip. Yeah, that would be a hip socket type of evaluation, and to see what part of the socket is maybe giving you trouble. So, yeah.
Good question. Okay, so one of the things that we got a question about from the Facebook page when we initially posted the thing is somebody that has had a rear end problem for a long time, and somebody's told them that they need to stretch their piriformis, which is one of the muscles that runs across the backside of our rear. So piriformis muscle runs from our sacrum straight across, right where my finger is at right now is where that muscle runs. And so they've stretched that and stretched that and stretched that and stretched that, and it's never gotten better. And so that person came in, we evaluated them, and guess what? Their piriformis was really flexible. They didn't need to stretch it. They've been stretching the heck out of it for a long time. But guess what we did find? When we have a very special type of strength testing device that we use that we can identify side-to-side indifferences and front-to-back differences. Is when we tested her, it turns out she had a lot of weakness in some of the other muscles, and so we discovered that she wasn't stabilizing well.
Right.
So that's a case where stretching actually is not going to help. In fact, probably even making it a little bit worse.
Right.
Where we need to do some really specific, what we call stabilization exercise, where we ask the leg to be in one certain position, and then we make all of the muscles around it fire and stabilize and hold that in place. And so there's times where stretching, therapist as a whole, if I could be a generalization, so I stretch. Well, there's times where we don't need to be stretching, where we need to do the exact opposite, and we need to be doing more stabilization, or some people are even extra mobile, hypermobile,
Right.
and we need to switch gears and flip it the other way.
Can I show them that Wichita State research glute exercise?
Yeah.
Okay. Wichita State University Physical Therapy School, they figured out how to increase your hip strength by 35% in 8 weeks. Okay? This is rocket science. Watch. You're going to stand up and you're going to squeeze your butt. Okay? That's rocket science. Squeeze your butt. Here's the key. You have to do it 150 times a day. Okay? 150 times a day in standing.
I thought it was 114.
150. I tell my patients 150. So here's what I do. I tell my patients at 7, 9, and 11 o'clock, 1 o'clock, 3 o'clock, and 5 o'clock, stand up and do 25 reps. Just squeeze your butt. Get it from here to here, because a lot of times this just shuts off. And if you can increase the stability here, you can help a lot of hip issues, okay? So that's your nugget for the day, okay? Rocket science nugget. Squeeze your butt and standing. It's research.
Yeah.
All right.
Okay, do we have any other questions there? Okay. So we're getting close to our end of our time. We wanted to finish up here within about 45 minutes. So if anybody still has some questions that they want to throw in the chat right now, that would be a great time to do that. And so get those up, and then we'll be happy to answer any other questions. We definitely, it's our goal to keep people mobile, active, and off pain pills. And so if you have something going on that's not allowing you to stay mobile or active, and or you're afraid you're going to need pain pills, or you're concerned that it's just not improving, if you're concerned that you're not able to do the things that you want or used to be able to do, that's what we do. That's what we specialize in. So if you'd like to chat more about us than what we can just do over electronic means like we're doing today, we're going to type in, or we're going to post for you in the comments a way that you can get in touch with us. And so Karen's going to put that up for you, and it'll take you to our landing page on our website that allows you simply to just give us your basic contact information. and then we'll call you. Basically, we'll set up a call where we can actually answer your questions one-on-one over the phone and make sure you get all your questions answered. So Karen's going to be putting that up for us. And then here's the other cool thing is we mentioned earlier that we're going to give away the foam roller on steroids, the Viper roller. If you missed this, this is a really, really cool foam roller that vibrates. And we have a lot of patients that use this, a lot of professional athletes that use this. And we use it here in the office regularly. And the value of these is $189, and we're going to give one away. So for everybody that contacts us through the link, through the website, within the next 24 hours, we're going to put all your names in a hat. And then we'll do a drawing, and somebody's going to walk away with one of these, and I promise you, you will love it.
Yeah, you will love it. You will love it.
And in fact, you don't even have to just use it on your hip. You can use it on your lower back. You can use it on the bottoms of your feet. You can use it on your thighs.
Armpit for
shoulder
issues. You lay it on the table and you lay on it like this, and it hits the armpit and these deep shoulder muscles. Helps with shoulder issues. Can't use it on your neck. Gives you a concussion, but we treat those too. So anyway, I wouldn't recommend the neck thing. It kind of rattles your brain.
Yeah.
But anywhere from mid back down, it works really nice. Love it.
Yeah.
Love them. So contact us. Set up a call request. We'll give you a call because we want to hear your story. We want to hear what's going on because everyone's story is different. And I think that's one of the things in medicine we see these days is people in medicine don't listen. And people need to be listened to. They need to be heard. They need to, because through your story, you're telling us what's going on, and we can connect the dots, so then we know where to look and what the root issue is, because people tell us such great stories. So that's what we like to do, is just take time to listen and hear it and figure it out. So
okay, we got another question. Go ahead.
Okay, Charmin says, I play a lot of pickleball. I tried that stretch you posted. Even with the assistance, I could not get much movement. Even after massage, foam rolling, and stretching, it still feels tight. Any other stretches or tips you recommend?
Gotcha. We might need to look inside your hip joint. So it may not be muscles that's keeping you tight. It might be your hip joint.
Could be your capsule
that's keeping you tight.
yeah.
Maybe show just what we're talking about.
It can be the capsule. So here's your socket, and then there's some ligamentous tissue that attaches from your pelvis out here to your bone, and that capsule can get tight in there. Okay, and that's what can limit how much you can rotate and extend and move your hip. And what you have to do is you have to get in there and literally stretch that deep hip socket, that capsule or that deep capsule on there. Because if it's tying the IT band and you do that, we may have to go deeper and look at that capsule in the hip socket.
And that's something, especially with somebody that plays pickleball.
Oh yeah.
You've got to have full,
mobility.
So you got to have mobility so you can move laterally on the court.
Right.
And then when you're going up to the net and so forth, and so you've got to have that mobility. So definitely something worth checking out.
Yeah.
And, feel free to use the link to contact us. We'd be happy to chat more details with you, and we can let you know. We always say we don't like to waste people's time or money. So if we feel like we can help you, we'll let you know. If we think there's another route you need to go, we'll tell you that as well.
Okay. Any more questions?
All right. Okay. Still, if anybody, there's a little bit of a delay through the internet. So if people have questions, feel free to type those in. Karen, if you wouldn't mind throwing up that link one more time for us, we'll get that up there. And so remember, everybody that contacts us through that link, and the next day we're going to put all your names in a hat and you register to win a Viper roller. And then secondly, if there's anybody, maybe you're watching this and maybe there's somebody that that you think this could benefit, like share this with them. If
They
you
get
would.
out of their chair like this, like an old person, and they got a limp when they walk, and they go, oh, my hip or my back. Send this over to them, okay? 'Cause that's, all you guys are like the choir. We're preaching to the choir here.
Yeah.
It's the people that aren't here that actually need it sometimes. So somebody usually knows somebody or knows somebody else that, hey, they need to hear this. They need to see this. So anyway, pass it along to them.
Have you ever been tempted to hand out business cards at the movie theater?
restaurants,
at the end of the
grocery
week,
stores.
everybody's getting out of their chair.
All those guys, people are walking and leaning on the cart. It ain't because they're tired, it's because their back hurts and their hips hurt. Yeah, I don't, but in my yes,
Yeah.
it's crossed my mind.
Yeah. Yeah. Okay, so we got the link up. If you have further questions, we're getting close to the end here. So if you have other questions, feel free to, and you don't have to just use that link. If you want to contact us through our website, which is bodyworksphysicaltherapy.net. We actually still like to talk on the phone, so you can call us at 316-558-8808. Through our website, we have multiple ways you can contact us from our website, bodyworksphysicaltherapy.net. And we'd be happy to chat, learn more about your situation, and see if we can help.
All right.
We got one more.
Okay.
One more question.
Okay, Sean says her husband has a 2 centimeter right leg length discrepancy.
Mm-hmm.
He complains of lower back pain and intermittent knee pain, all in the right side.
Mm-hmm.
Do you recommend any stretches, heat, or traction?
2 centimeters is quite a bit, so that's just under an
Almost
inch.
an inch.
Yeah.
So that's certainly enough to throw your pelvis out of whack.
Totally.
It's certainly enough to throw your back out of whack. Certainly, and it actually changes the angle of your ball and sockets
Right.
inside the hip joint.
Right.
So that would be one that definitely would bear more. Would really need to bear
Right.
more.
That's looking at the entire
investigation.
leg and the foot
Yeah.
too, and looking at the length and how to address that. It's usually not a stretching issue. There's some secondary stretching or some muscle compensation patterns, but that leg length is a structural thing, and so there's some things, some workarounds you can do to help with that. So yeah, we see that a fair amount, especially like people that had total hips or total knees, and now one leg's longer than the other, and they walk with a limp now. They go high, low, high, low. What do you do about that? Well, that's what we do. We figure that out, and so then they walk more even. So yeah,
But it's important to not just blanketly throw a lift in your shoe, because you also have to look at your back.
right,
Because if your back is if your back is curved
Right.
to compensate,
right,
and you correct the whole thing, sometimes if you correct the whole thing, it kind of monkeys stuff up.
right.
And so looking everything as a whole, and
Yeah.
then from there you
From
can
back
make-
to feet, that would be a
make
back to
a-
foot eval.
Yeah.
Looking at that. So yeah, great question.
Yeah, very
Thank
good.
you.
So I think that's all I've got. Once again, if you have any questions, feel free to contact us through the link that we put up. Feel free to email, call, whichever.
Yep.
We definitely appreciate everybody who jumped
Yes,
on
thank
with
you.
us today. Thanks for making time in your Monday evening to hang out with us and learn more. And like for us, like this is the stuff we love to do. We
Yeah,
love to
do it every day.
educate people and talk, and we like people to understand what's going on, and we definitely are educators at heart. So we appreciate everybody who got on with us today. We hope it was helpful, and if it was, we'd definitely love it if you gave us a thumbs up. We'd love it if you put in, is there other topics you want us to talk about?
Other topics.
Type that in for us. Let
Neck,
us know.
shoulder, back, knee, foot. We just did a foot one. Our last one's a foot one, but diagnosis, and we can group those together and do a talk on that. So.
We do these every couple months, so
Yep.
be looking for it. Make sure, if you haven't, if you would like our page so that you'll get notified about this
There you
stuff. And then another resource we've got, if you go to our blog page on our website, bodyworksphysicaltherapy.net, go to the blog page, and then if you go to there and look for our link to our YouTube channel, we've got, I don't know, probably 10 or 15 different hip related videos or blog posts. We've got some podcasts on our podcast page. Like we've got a lot of other resources.
Yeah.
If you just want to learn
Hips
more.
and low backs kind of go together. So
Yeah.
combination
So,
stuff.
Feel free to check that stuff out.
Yep.
And hey, until next time, thanks for joining us tonight. We enjoyed it. We hope you did as well.
Yep.
And until next time, we'll see you later.
And we are out of here.